Hello, my name is Maya McDoom-Echeverry, and I am from Hyphen Health, a boutique public health consulting firm focused on improving equitable policies and practices within health systems. We have provided technical assistance to Medstar to integrate the electronic version of the Maryland Prenatal Risk Assessment, also known as the ePRA. Today, we are hosting a demo of the ePRA within MedConnect. But before we jump in to the demo, let's briefly talk about why the prenatal risk assessment is important. The PRA captures information about pregnant people who are eligible for Medicaid and other wraparound and safety net services that address risks such as housing, transportation, food instability, or substance abuse. The benefit of the ePRA is that it supports pregnant people during a vulnerable time by ensuring clarity and legibility of the information captured. And it creates efficiency in ensuring that the information is submitted in a timely manner to make sure that gaps in care are closed. The PRA is a Maryland state regulation that mandates completion of the form at the first prenatal visit and submission to the local health department in the county where the pregnant person lives within the first 10 days of that visit. All right, I'll turn it over to Deidre to walk us through the ePRA demo within MedConnect.
Good afternoon and welcome. My name is Deidre Coulter, and it is my pleasure today to walk you through the electronic PRA process. This video training will provide details on the documentation workflow and expectations of the electronic PRA process within MedConnect. As Maya shared, the Maryland Prenatal Risk Assessment is a required form to be completed according to the COMAR regulations for all pregnant people on Medicare or those who are Medicaid eligible. This document connects individuals to a variety of safety net services such as transportation, which can help reduce no-show rates and ensure people are receiving the wrap-around services they need for healthy maternal and child health outcomes. As we move to implement this electronic process, please understand that the site workflows and engagement with the patient should remain unchanged. The electronic documentation will be beneficial to teams by replacing the manual paper process and upon completion, auto-faxing the PRA to the designated Department of Health based on the patient's county of residence. Although site workflows may vary, let's take a moment to highlight the ePRA expectations within the Women's Health Ambulatory offices. The patient will have the PRA completed by the clinical staff at the first OB visit. During that OB visit, the patient under 14 weeks or less will attend a nurse education visit. During the nurse education visit, the nurse completes the patient history, orders applicable OB gestational labs, reviews consents, and may also complete trimester applicable education. Let's now transition to MedConnect and review the process. After logging into MedConnect, we'll walk through the process within the patient's chart. Please note that we are working on ZZZ test DDC Teresa today, and this is a test patient chart to protect live patient privacy as well as confidentiality. A few important notes prior to completing the ePRA. One, prior to accessing the form, please ensure to review the patient's demographic information, confirming their current residency and identify the county of residence or jurisdiction. This county information must be accurate and must be added to the ePRA form when completed. In addition, if patient blood work needs to be transcribed within the medical record, the transcription should be completed in iView INO under the Transcribe Lab Band section. So here within the Transcribe Lab Band section, we will then navigate to the OB Labs initial and complete that Transcribe Lab documentation. Additionally, please ensure that the following documentation has been initiated. 1, the current pregnancy incident has been added via the Add Pregnancy component. And as you see here, the patient's pregnancy is started and that pregnancy information is available within Pregnancy Overview. By the pregnancy being added, we have available both the patient's EDD as well as EGA. In addition, we ask that you please also review and complete the OB history, which should be documented to pull forward an accurate gravity and parity. So within histories, again, documenting that pregnancy detail thoroughly to then generate the gravida as well as parity. Now let's move to completing the ePRA form. To access the form, we'll first navigate to and click on Ad hoc in the main toolbar. Next, within your OB/GYN folder, we will then select the ePRA form. So I will navigate first to specialties, select OB, clicking on the ePRA form. In the bottom right, you then select chart. You will see that there is a note at the top of the form that we ask that you review prior to documenting. So the statement reads that completing and signing this form will generate an electronic version or PDF of the form that will be auto-faxed to the Maryland Health Department corresponding to the patient's county of residence. This form is required for Maryland Medicaid eligible OB patients. Now we will continue down below and document the information for our patient today. First, we will start by documenting the provider name as well as the provider phone number. You certainly have the option of typing any portion of the provider's last name, comma, first name, or you can simply select and click on the search box to add the provider's name within the database. In locating my provider, I will then select OK to pre-fill the field. I will then work to add the telephone number. Please note that no parentheses or dashes should be used. Next, we will document the provider NPI. And if available, document the site NPI as well. Next, you will see that the county of patient resident is a required field. So the expectation is that this field is completed. Otherwise, the form cannot be signed. So in selecting the dropdown, I will then choose the patient's appropriate county of resident. Thereafter, then answering the language barrier as well as requires interpreter fields. Navigating down below, we will then also document the patient educational level information. Scrolling to the next section, which is our insurance status section. Please note that the insurance status is only applicable to the insurance that is available at the time of the prenatal visit. Let's document. I will add the patient confirmed that she applied for Maryland medical assistance back in September. Add that she does have Maryland Medicaid, and then document the medical assistant number. Please note that the medical assistant number should be an 11-digit format, numeric values only. Moving on to our next section, we will then continue on to document any OB-specific data. Documenting that today is her first OB visit. She was not transferred from other sources of prenatal care, and this is her first prenatal visit. Within the risk factor assessment section, we have used a combination of grid fields to highlight the patient's uniquely positive and or negative psychosocial, medical, as well as pregnancy risk factors. Within the free text box to the right, please be mindful that there is a data limitation of 255 characters within this free text field. In completing documentation, you have the opportunity to single select all fields by clicking on the yes or no header, whichever one is applicable, or you can certainly choose to single select for each DTA response. So let's work to complete that documentation. As an important note, for any of the free text fields in the risk assessment section, please refrain from using carriage return, or in other words, please do not use enter, as it will contribute to overlapping within the PDF. Let's add some information. Once all of the documentation fields have been completed, you will then click the green check mark in the top left corner to sign and finalize the ePRA form. As a note, it may take several minutes before you can locate the saved PDF within clinical documents. You should then be able to access the PDF form under the Health Department reporting documents. Let's refresh our screen and take a moment to see if that form is yet available. Now let's take a look and see if we can access and review the PDF preview within clinical documents. So again, to access the form, we will click and highlight the Health Department reporting document and double click to open the Maryland prenatal risk assessment. At the very top, you can see our ePRA document that is available, and within the document, we have available the attachment, which is our electronic PDF. At the top of the PDF, you can see that the patient demographics auto-generates, auto-populates from the chart, from available chart data. We can also see that the data that was captured via the ePRA Power Form does pull forward to the ePRA PDF. In scrolling below, we should be able to also recognize that the patient's OB history as well as G's and P's are available to review. Lastly, please note that the patient's BMI as well as the H&H lab values will also auto-populate based on the patient's charted data within the PRA PDF. In closing, few items I would like to highlight. First, if there's a need to make updates to a previously documented ePRA, the updates must be documented in a new form. Please do not modify previous forms. In addition, the PRA eFax is set to auto-send faxes on a Q4-hour time schedule. Lastly, to again highlight, in accordance with Maryland state regulations, all pregnant patients on Medicaid or those who are Medicaid eligible should have this form completed and submitted to applicable health departments from within MedConnect. That concludes the Medstar Health MedConnect Women's Health ePRA workflow video training in MedConnect. Thank you.